Cravings versus Libido. Hi, my name is Luke, the PhD, clinical psychologist, mental health expert helping young men overcome digital addiction, depression, and anxiety. In this video, we're going to be distinguishing between libido and cravings as two separate concepts. Do you have a high libido or just poor self-control? Well, here are some questions that might help. Quick disclaimer, I'm not your psych, this isn't treatment, and if you need a psych, you should find a registered, qualified psych in your area. Let's start with the basics. What defines libido and what defines cravings? First, sex drive or libido is the basic motivation to initiate, engage, and be gratified by sex. It's a normal and healthy desire that can vary greatly across people throughout their lifespan. For my patients seeking help with pornography addiction, it's usually really hard to tell if your desire to use pornography is actually because of your sex drive or because you're letting your self-control go unchecked. Again, your actual sex drive and your urges are two different things here. Urge control is a thing that stops you from eating that burger at 2 a.m., smoking that cigarette, or going on Netflix when you have lots of stuff to do. When we say urges in this video, it's meant generally, not only referring to sexual desires. Urges or cravings are often triggered by external cues, such as images or situations where you may have used pornography excessively before. A classic example is when your partner is going away on a business trip and you finally have the whole place to yourself. Urges and cravings tend to increase in intensity when general health and stress deteriorate, sometimes as a form of maladaptive coping. Conversely, libido, or our willingness to invest effort to go on dates or be intimate with our partner, increases as our mental and physical health improves. Can one even tell the two apart in our day-to-day lives? Well, there are 5 questions to examine your desires and your thoughts. Is sexual motivation related to intimacy and your partner, or are they related to mood, stress, or anxiety? Have an honest look at your thoughts and what you're doing at the time. Is it to escape what you're currently doing? Ask yourself if your arousal is intrinsically generated, or are you only aroused after viewing pornography? Is pornography overtaking real-life partnered sex, or being prioritized over important tasks or goals such as working or studying? Is there resistance in abstaining from porn, regardless of personal negative consequences? And the most obvious one of all, do you consider your porn habits excessive by your own standards, beyond what you would consider as healthy sexual expression? If the answer is yes to any one of these questions, that's how you know you're responding to urges and not your libido. What are some negative implications of attributing a craving to our personality? Well, some patients report that they have an addictive personality. The issue is this isn't really how psychologists like to think about vulnerability to addiction. Often we want to be precise. So for example, do you have an impulse control problem, a self-regulation problem? What external factors are affecting your impulse and compulsions? Often, if we attribute to ourselves that I have an addictive personality, we discount the potential for meaningful change and self-improvement. Sometimes we're easily distracted, or we're easily fatigued, or we have this strong initial enthusiasm, which makes us believe that we're poor self-regulators. Now, this isn't true. Discipline is a skill that when repeated can become second nature and actually become integrated into your own personality in a more valid way. Sometimes we aren't aware or don't even create resistance to the unwanted pattern. And the more we practice wrestling with our urges and cravings, the more successful you become at overcoming them. Is it important to trace back how this habit was built or just address the issue at hand? A general rule is that if your problematic porn use is not severe or chronic or persistent despite repeated attempts at quitting, you can make heaps of progress just focusing on the immediate patterns. This might mean urge management techniques or environment control techniques, which I've covered in previous videos, so check out the links in the description. However, if it's a clinical problem that creates significant impairment in your ability to work and love, and it's persisted for more than 6 months, or there's a potential of injury or self-harm present, it's important to do both. If a continued repeated pattern persists despite your efforts to quit, then there might be an unaddressed cognition or pattern that might be perpetuating the problem. It may be a lack of self-worth, unhelpful beliefs about sexual expression and shame, relationship issues, identity issues, unresolved historical current trauma, even abuse or unprocessed past events. This is where therapy comes in, because your journey to a resolution can be facilitated and processed to ensure that you're at the least risk of relapse. As always, it's good to start with pragmatic methods first. So we'll wrap this up with a final checklist. What are good questions to ask ourselves before responding to a craving? What am I feeling and why? If I use pornography now, how will it impact my productivity? Can pornography wait until I finish my task? Am I really feeling sexual desire, or am I just distracting myself? Am I willing to invest energy and effort to meet my sexual needs in a healthy way? Remember, your libido and your cravings are two separate things, which require different tools. I really hope you found this useful. Don't forget to hit subscribe. I'm Luke Vu. Be kind, be you. Catch you next time.